Good Tuesday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is more so a moment of recognition, dedicated to the individuals and families that have experienced COVID-19 firsthand. Whether from getting the virus themselves or watching a loved one get sick, we have seen this virus present as mild and deadly. Our thoughts go out to those who are still recovering, and we continue to urge everyone to practice the 5 core actions in every situation to reduce the risk of spreading this virus. Our real-life example of putting the 5 core actions into play is staying with a family or friend member out of town. When staying with friends or family, it can be easy to let your guard down because you're so comfortable and don't think they can do anything bad to you, and you wouldn't do anything bad to them. But that is just the opportunity this virus needs to spread. Remember to keep at least 6 feet of distance from you and anyone else who isn't in your immediate household. If you can't maintain that distance, wear a mask. It will likely feel strange to wear a mask in your family's house or a friend's house. But this is so important to protect yourself and those around you from the spread of this virus. As we know, asymptomatic transmission can and does occur. If possible, households should be using separate bathrooms and staying in separate bedrooms. Make sure to disinfect commonly touched surfaces regularly and wash your hands often. If everyone is planning to eat together, try to do so outside where it's easier to physically distance. As always, if you're not feeling well or think you may have been exposed to COVID-19, reschedule your trip. These are just a few simple tips that can help protect you and those around you while still going about your life. We continue to test this week, Monday through Friday at the Jacob Building in Chehalis Park from 9 a.m. to 3 p.m. The Board of Health will meet via Zoom tomorrow night at 5 p.m. The public may watch the meeting live on Knox County's YouTube page, website, or on community television. Now we'll move to the local situation. We have 219 new confirmed cases since yesterday's report, giving us 8,590 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 324 probable cases. 6,892 of our cases are considered inactive, giving us 1,955 active cases. 312 individuals have been hospitalized at some point in their illness. Currently, there are 34 individuals or 34 Knox County residents hospitalized at this time. Fortunately, we have no further deaths to report today, keeping our total at 67. Once again, we are seeing another large daily increase in new cases. I realize I am sounding like a broken record, but it is critical that everyone in our community take personal responsibility for their actions to keep themselves and others safe and healthy if we want to have any semblance of normal life for this fall. We've all got to practice the 5 core actions. We know COVID isn't going anywhere soon, and we know that's hard to hear. It's hard for us to hear. It also doesn't have to be as big of an impact on our community as it's currently having. If everyone follows the 5 core actions in every situation, our community will be safer and healthier. These actions allow you to keep doing the activities you love and live your life, just with some modifications. So now I'll open up for questions.
All right, the first question we have is from Alan Sims with Inside Knoxville. After fluctuating for months, the number of probable cases has risen every day since the beginning of the month, setting a new high each day. Why is this number never dropping as cases are resolved? What changed?
Well, honestly, what's changed is the number of contacts cases are having, and our case counts have gone up as well. So our cases have more contacts, so then we end up with more probable cases, and our case counts have continued to go up as well. So those are all those things are connected.
From Brian Hornback, Dr. Burks mentioned not a bar closure, but an alcohol cutoff curfew where no alcohol would be purchased or consumed after a certain time. I do not recall the Board of Health considering or debating that. Is this a possible scenario for the Board of Health to consider?
Great question for the Board of Health, and they meet tomorrow night.
From Paul with WBIR, we've seen a slight dip in UT's latest virus counts. Hasn't the UT chancellor asked for bar closures around the strip to help quell the spread of the virus? And from a medical and scientific standpoint, does the health department think that would help mitigate the spread among the student population?
So one of the things that we learned from Dr. Burks today, because they're able to see across the country and see what trends are happening, what's happening in other places. And what they've been able to see is that stopping the consumption of alcohol at 10 or 11 p.m. Has an impact on case counts. So I'm hopeful, I think based on that information, there's some data to support taking that action.
From Vincent with the Sentinel, Dr. Burke said that county officials should reconsider their COVID mitigation efforts in cases like Knox County's rising cases and increasing positivity rates. Do you agree with that assessment?
I agree, and we're doing that.
Also from Vincent with the Sentinel, did Dr. Burke speak with KCHD Board of Health members or county officials about possible mitigation strategies?
Well, as stated previously, she did talk about what they've learned from other jurisdictions across the country and did bring those things up, such as limiting alcohol consumption or stopping alcohol consumption after 10 p.m.
And his follow-up question was, have any new enforcement strategies been shared with the county by Dr. Burks?
I honestly don't, what I've talked about is what she mentioned. Did not meet with the Board of Health. She met with other leaders in the community. So I was there, and from the Board of Health, Dr. Shami was there.
From David with WBLT, with 25% of school-age cases in the last 14 days, what is the outlook for area schools?
Well, I think that a lot depends on the behavior of students inside and outside school and families inside and outside school, just like it does in our community. How this virus spreads depends a whole lot on human behavior. And it's really hard to change human behavior, but it's really important that in school and out of school, everybody, no matter where we are, at work, school, play, that we're observing the 5 core actions, and that's what's going to make a difference in spread in students and in families and at work.
David's second question is, what is the health department advising schools?
We're working with schools and giving them the same advice we're giving the community, the importance of the 5 core actions and evidence-based public health advice based on the situation with the school.
From Paul with WBIR, does KCHD have oversight over bars or restaurants when it comes to public health rules?
So we do have a regulatory relationship with bars and restaurants through our food service division. However, that relationship is limited to the food code, and regulations related to COVID-19 are not related to the food code or not part of the food code.
His follow-up question was, if KCHD does not, who does?
So we do in certain situations, and then depending on what the board passes or how that's written, it could be law enforcement, it could be public health, it could be a combination of working together. I'm not sure what that would look like.
Other follow-up from that question is, if KCHD does, how do you decide when to enforce or educate?
Well, okay, so let's separate 2 things out. We have a regulatory relationship, 365 outside pandemic existing way before the pandemic happened, with restaurants and bars related to food service. That's very well outlined in the Tennessee Code and in the food code for how we walk through that. So it's very detailed, and I would get it wrong if I tried to remember it, but that's very well documented and detailed, and we follow each of those steps. It always starts with education and an opportunity to change what they're doing. So then let's talk about COVID. So with COVID, there have been different regulations, not part of the food code, not part of that piece that we do with the state. So again, we start with education and informing folks and helping them become compliant. We have not yet had taken any regulatory action on a bar or restaurant related to COVID at this time.
Also from Paul with WBIR, has KCHD seen fewer people coming to get tests, or has the rate remained steady?
I don't have our internal numbers, but what we do know, what's important, and thanks for that question, because this is a point I wanted to make. We are seeing our testing numbers across the state and across the country go down. And that's very concerning. We talked a little bit about this last week. It's concerning for lots of different reasons, but one is that what we know is that we have cases in the community, and what we are concerned about is that people are not getting tested for whatever reason. They're not getting tested because they don't want to be in isolation. They don't want their family or friends to be in quarantine, whatever that might be. But what that means is that person who is a case, and maybe they're not very sick, or maybe they're not sick at all, they're spreading it to their friends and family, the very people they're trying to protect from being in quarantine. They're spreading it to those folks. And so really encourage people to get tested. We know that being in isolation and being in quarantine is really no fun, and it's really hard to do, but it's what protects our community. And it's a proven public health practice. This is not new. We do this on a regular basis with other things, 365 days a week, 365 days a week, 365 days a year. It's our job as public health. It is a proven practice. COVID is real. When our folks call you and tell you need to be in isolation or quarantine, please listen to them and cooperate. It protects you, it protects your family, it protects the rest of our community. So it's very important that we have the cooperation of the community. We don't always get that. And so that's frustrating for us. And just like many other public health practices, we rely on community compliance to make it happen. When we look at restaurant regulation, we rely on that restaurant owner to follow the rules and guidelines to keep the rest of the community safe and healthy. We rely on everybody to drive on the right side, correct side of the road. We rely on everybody to stop at stop signs to keep all of us safe and healthy. Right now, during COVID, we're relying on everybody to follow our guidance for isolation and quarantine. So we're asking our community to cooperate, because it's really not happening all the time.
From Vincent with the Sentinel, last week, Dr. Buchanan said it was difficult to scale up the procedures that the county health officer / county health department director would use to enforce health measures. Have you reconsidered the way that such enforcement actions are handled and filed?
Well, honestly, the way those are filed isn't up to me. It's not something I can reconsider. I think one of the challenges that we've seen during COVID is when you're going to have a regulation, if you want to try to enforce it, it needs to be really clear and kind of, I don't want to say black and white, but almost black and white. So it's really a coordinated effort between law enforcement and public health and others to potentially enforce anything that's out there. And in order to do that, it has to be really clear and easy to be able to say, you are or you are not doing what the regulation says. I'll use food as an example again. Your food is either in temperature or it's not. And so to be able to say that helps us be able to go, okay, this person is not this person is in violation, and we need to take steps to help them get into compliance. Again, starting with education and then taking other actions if necessary.
From Paul with WBIR, Dr. Burks advised asymptomatic testing, especially for young people who make up 52% of our new cases. Do you agree? And how should people in our community decide when to get a COVID test?
So I think that we need to first of all, look at symptomatic folks, of course, and then contacts of cases are also a priority, and those working in healthcare. Certainly anybody who's asymptomatic, who's concerned that they were exposed to COVID, they need to be tested. But if you've never been exposed to COVID, like you haven't left your house and nobody's been to your house and you feel fine, maybe you don't need a COVID test. But if you've been out and about and you're concerned you were exposed to COVID, we want you to get tested.
From Vincent with the Sentinel, you keep mentioning trends Dr. Burks is seeing cross country. Can you elaborate on specific points or trends she addressed in her meeting with you and other county officials?
Okay, I thought I did. So specifically what she talked about was in communities where they made a change to the access to consumption of alcohol after 10 or 11 p.m., they see a decrease in cases. So in places where cases have gone up, they've taken an action, and then those cases have gone down. So that was really, she's focused a lot on that in her, or not a lot on just that, but that was one of the trends that she'd seen across the country. And also just that taking action and finding a way to get community buy-in to participate in the 5 core actions is really key to squelching this virus. It's going to take all of us to do that. And she did talk about how there's an example from West Virginia that I haven't had a chance to look at yet because I've been getting ready for this, where they're using some stuff, some information and data that's sharing with the community and really giving ownership to the community to keep them in a zone where they can keep doing things like having football games and other things like that. So we'll look at that and see if that seems like an appropriate approach for us to take as a community.
From David with WBLT, what notices has KCHD got on getting ready for possible vaccine?
Oh, wow. I don't know that. So we've had a lot of communication back and forth with the state of Tennessee in preparing for receiving vaccine and planning for giving vaccine. There have been calls, there have been emails. I haven't been involved in all of those. We have an internal team that's looking at what we might do locally to get vaccine out into the community. We're using some of the things we learned from H1N1 and getting vaccine into the community as quickly as possible. We know that means that gets it into patients and to people. And so, we don't have any information on when we're going to get it. We don't have an inside scoop on when the vaccine is going to be here. We will keep you informed when we know more about availability of vaccine. But from 15 years of flu season and knowing that we don't count vaccine until it's in our door because it's a lot of times it's kind of like the checks in the mail. We keep waiting for it and it takes longer than sometimes predicted for it to get here.
Jeff with WATE, do you think the Board of Health should add a citizen representative as proposed by County Commissioner Biggs?
Well, actually, if you look at the Tennessee Code, that's a decision the commission can make. The commission can choose to appoint a citizen member. It's not up to the Board of Health, it's up to the commission.
Vincent with the Sentinel, can you explain why no action has been taken with businesses like restaurants and bars other than education? Community buy-in is important, but it is also a component of traffic and other laws that there are consequences of some kind for violation.
I'll be honest, it's really hard to enforce some of the things that we have on the books. We've really been trying to take a less heavy-handed approach to these things, but also look at all the different things that are required for that. You've got to have clarity of the regulation, and then you've got to have support from law enforcement, and those two things aren't always there. And so it's been one of those things where it's really not something that health department can just do alone. You have to have support of law enforcement and even the court system to take those actions.
David with WBLT, what new treatments are showing promise for local cases, and are we in a better place for treatments than 6 months ago, and why?
Well, it's a great question for our hospital partners who are actually treating COVID cases. We don't treat COVID cases and don't track that information.
From Jeff with WATE, what's the status of the school flu shot program?
So right now, what I know is that we have planned to do some events later in the day at schools so that we can capture moms, dads, and kids with flu mist and vaccine and injectable vaccine as well. I believe those dates have been confirmed. I don't have them off the top of my head, but they're scattered throughout the county. It won't look like it's looked in the past because, we talked about before, going into a school with a whole bunch of people and bringing a whole bunch of kids down at the same time really can't be done during COVID. So my amazing team has put together an alternative plan, like all of us are having to do for lots of different things in our lives, in an interest in getting as much flu vaccine into our communities as we can, so that we can protect people from the flu. So it's going to be on some school campuses. Some of it's not on school campus. Some of it's in different places, but it'll be open to moms, dads, and kids. And we're excited about it. We'll look and see how it goes. If we have success, maybe this is the new in-school flu vaccine, just in a different model.
Vincent with the Sentinel, we have heard at Board of Health meetings that law enforcement support has been difficult. Are you saying that the courts have also been problematic from an enforcement perspective during COVID-19 as well?
I'll be honest, I haven't had to approach the courts about that. So, but they are part of that system. So I haven't had the conversation, haven't had to approach the courts.
All right, any other questions? Please go ahead and submit them now. From Brian Hornback, are schools notifying the virtual students about the flu shot I think missed is what you meant, program?
Yeah, so we'll work with the schools to communicate that out through their normal channels like we always do.
All right, any other questions? Please go ahead and type them in now. All right, not seeing any other questions come in, so thank you all, and we will see you again at 12:30 on Thursday. Have a good rest of your day.